Hi everyone, Nadia here from Oxigo. A question we get all the time is this: is CPAP the same as oxygen therapy? And honestly, it's a great question because both involve breathing, both use machines, and sometimes people even use them at night. But here's the truth. CPAP and oxygen therapy are not the same thing. They solve completely different problems. And today I will explain the difference in a super simple way, so you will finally know which one does what. Before we start, make sure to subscribe to our channel and follow Oxigo on social media. We share weekly tips to help you get the most of your CPAP and oxygen therapy. Let's start with CPAP. CPAP stands for Continuous Positive Airway Pressure, and here's the key idea. CPAP does not give you oxygen, it gives you air at pressure. If you have obstructive sleep apnea, your airway collapses while you sleep, and your body tries to sleep, but the airway is blocked. CPAP works like a gentle air splint. It keeps your airway open so you can breathe normally. So CPAP solves a mechanical problem, a blocked airway. It doesn't increase oxygen levels directly, it just makes sure that the air you are already breathing can actually get through. Now let's talk about oxygen therapy. Oxygen therapy is completely different. It's used when your blood oxygen levels are too low, and this can happen with conditions like COPD, lung disease, heart problems, or sometimes after surgery. Instead of pressurizing the airway, oxygen therapy increases the amount of oxygen you're breathing in. So instead of normal air, you receive a higher concentration of oxygen. Here's the easiest way to think about it. CPAP keeps your airway open, and oxygen therapy increases the oxygen levels in your blood. One fixes the airflow and the other fixes the oxygen levels. Different problem, different solution. Can you use both? Yes, and this is where people get confused. Some patients use CPAP and oxygen therapy together. For example, if someone has sleep apnea and low oxygen levels, a doctor might prescribe CPAP with supplemental oxygen connected to it. But that decision is always medical. You should never add oxygen to CPAP without a prescription. How do you know which one you need? You don't choose this yourself, because if your issue is sleep apnea, CPAP is usually prescribed, and if your issue is low oxygen saturation, oxygen therapy is prescribed. Sometimes a sleep study or blood test determines that. That's why diagnosis is so important. So now you know, CPAP helps you breathe by keeping your airway open, and oxygen therapy helps by increasing oxygen in your bloodstream. They may look similar, but they are not interchangeable. If you want to learn more about CPAP machines, oxygen concentrators, or how they work, visit our website oxigo.co. We're here to help. If this video clarifies things for you, give it a like, subscribe, and share it with someone who might benefit. Thanks a lot for watching, and I will see you in the next video.